If we are rooting against this vaccine, then that means we are rooting for death. We have seen thousands and thousands of people having to recently pour out into the city streets to declare that their lives matter, that their lives have dignity and worth and value. That's not just a criminal justice scream. That is a scream that translates itself all the way into the sacrosanct environment of the healthcare system. We are saying to our community, we understand those feelings. We understand the legitimacy of the upset and the anger, but we have to move past it. Its toll on Black life is much greater than it is on any other segment of the American people for a variety of reasons that have to do with the jobs that we have, the being essential workers on the front line, the crowding in our homes, the living in multi-generational housing with one bathroom, which makes it difficult to comply with the quarantine and isolation advice. And we know that Black people's pre-existing health status with a much higher level of pre-existing conditions make it very difficult to fight the virus once it is introduced into our bodies. There is still a pervasive unequal treatment when it comes to the quality and availability of care for people of color. I think it is a very profound thing to have this level of Black leadership, Black talent, Black expertise, making a conscious and deliberate decision to pull together, not only to sign a letter, but to do the work that the letter requires. In Washington, D.C., our coalition very much benefits from a very special relationship with a group of churches that have created something called the virtual health ministry, where these are people from the congregation who have become deputized to check on their own members, making sure that they are following the public health guidance and looking at those who have been infected and what their needs are. We're also doing the same thing with the musicians and artists, poets. We are conducting town halls, social media engagements. All the way back to the 1930s with the infamous Tuskegee syphilis study, men with syphilis were untreated, even though there was a drug available to do so, but were untreated just to see what the course of the disease would be if left untreated. One of the great horror stories of the American research experience. There is hurt and pain on so many levels. It is almost incomprehensible to me that 40 years later, we have done nothing to take this issue of distrust of the science and medical care and health policy communities off the table. We really are saying to our community, we understand where you are, and we are approaching you with love and compassion and with an understanding of how you feel. But at the end of the day, we have got to move forward. There are people of color who are at every level of decision-making regarding this vaccine, including the science of producing it. A young Black woman researcher, key to the research effort on the vaccine, the head of the National Heart, Lung, and Blood Institute at the NIH, a Black man in a position of authority looking at these issues. On the committee, reviewing the trustworthiness of the data from these clinical trials for these vaccine candidates. African-American man on our committee, the president of the Meharry Medical College. We are all over the place looking at this data, being able to be trustworthy reporters of the facts. All of our members are actively engaged in spreading the message throughout our community in every way possible.